Sagging facial skin, feeling a bit jowly, neck folds, want to explore plastic surgery, but not sure where to start. Most patients hear words like mini facelift, full, smash, but don't actually understand what they mean, myself included. And today we have plastic surgeon Dr. Jeremy White, who breaks down multiple facelift approaches and issues that you may be having and how to address them.
Hey, Susan, thanks so much for having me. It's going to be really fun.
Great. I'm excited. When patients come to you saying, gosh, I want a facelift, what are you seeing that they're pointing to in the mirror?
Usually it's a combination of things. So as we continue to age, it's exactly what you're talking about. It's the loosening of the jowls. Things are starting to hang, the neck. They're, especially given all the Zoom calls we do now and the social media, people are a lot more attentive to their neck and their chin. And so these are the things that tend to bother people, and we're noticing it at a younger and younger age now as well. And that's a couple of things going on. One is we have lots of technologies and techniques to help people to rejuvenate the areas, and people are realizing, well, why do I need to wait? Why do I have to be, I don't have to be 50, I don't have to be 60 in order to fix this. I can enjoy this at a younger age. So I think it's part of that is the realization that there are lots of options out there, and it's available. It's no longer just for the super wealthy to have plastic surgery. It's for everyone.
And the information out there can be confusing. There's so much of it.
Yeah, so it's very confusing because these days everyone is a expert on the social media, whether it's about politics and now it's whether it's about facelifts and medicine. So you will have people, it's almost like the blind leading the blind sometimes. You'll go on these groups and people are talking about facelifts, for instance, as if it's dogma that one technique is better than another technique and you must do it this way. And it's amazing because as you see it sort of progress, it's just an echo chamber. And then someone comes in with a problem. And it's nice because on the one hand, it's a nice thing to have because these are support groups, right? You have people who've gone through these procedures, who can help each other go through it. And there are two things going through my mind. One, why are they not going to their doctor and asking their doctor these questions? Do they not feel the comfort about addressing this with their doctor or with the staff? And just often it's just routine healing things. And then the other thing is going back to the blind leading the blind. Well, oh no, they're asking other people, what should I get before they go over to see a professional? And you'll get anything from, well, honey, you just need some facial yoga and you'll look 10 years younger, to, well, you must get a deep plane facelift and this is the only way to do it. And then even within that, you will see in these groups, people saying, oh yeah, everything's great and fine and dandy. And then someone has a problem. And it's a good thing because people are there in these groups to support each other through these problems. So it's actually kind of nice to have that community. But it also brings to light that surgery it's still surgery. It's not benign. It's not like just buying a purse. You're going on an experience. You're going on a journey together with a surgeon and with the staff and everything. And things can go wrong. And all of a sudden, all these people start chiming in, oh, honey, no problem. I had a facial nerve paralysis for 9 months, but you'll be okay. It'll be fine. Go talk to your surgeon, please. Please go talk to your surgeon because there are things that can be missed and there are things that potentially can be done. Don't rely on your Facebook group for this. And I think part of that is really, I don't know if it's that people are nervous about talking to their surgeon. Is the surgeon going to get mad at me for something like that? Perhaps there's some elements about that, but I think that's a problem from the get-go. It should be that you're choosing someone with whom you can develop a relationship, who's open to all of this, who's attentive and listens to you and is going to help you through all these things. And I think that's really what separates the good from the greats. It's one of the many things. It's not just a technical thing. It's also helping the patient get through the good times and the bad times and the whole healing process.
Let's start with maybe some of the most minor kind of indications of aging that some of your patients would want to address. And what are those and what might you recommend to them?
Yeah, so the main things that happen as we continue to age are volume loss in the cheeks, volume loss in the jawline as well. You lose fat along this whole area, and you actually lose bone over time. Your soft tissues start to atrophy. All the support structures just kind of start loosening up. So as we lose mid-face volume, we lose support along the jawline, the jowls come down, the neck comes down, the muscle bands develop. So all of that happens, sort of, gravity, you can't beat gravity. So that's what happens. And on top of that, we have the weight loss revolution. I mean, these medications are miracle medications. Patients are having just tremendous changes and feeling great. They're more energetic than ever, but now they just look older because they've lost all this volume here and everything is just coming down. So that's even brought this, surgical rejuvenation to a whole new level where we're seeing younger patients who've lost all this weight as well who need surgical solutions.
So, okay, good point. If somebody does come in and they've lost a lot of weight, what do you see and what recommendation might you make?
Yeah. So it depends on how much they lost and where they are in life. So it may be something as simple as, hey, you lost, 5-10 pounds or something like that. And if they don't have a lot of true sag to everything and they just need some volume replenishment, then we can talk about things like fillers. Fillers are a great mainstay to start, right? So we want to start to reestablish some volume in the midface, along nasolabial folds, along marionette lines. Very common things you can come in and do in the office, no big deal. I think using very simple, like one of the easiest things you can do early on is just support your skin with sunscreen. Okay, so protecting from the sun. Don't smoke. That's really, really bad for your skin. And then also using things like retinol or heroin, which is stronger, and that can help you maintain collagen in your skin as you age past a certain point. So all of those things are great to start off. As it becomes more dramatic, then we start to look at other things. So for more mild sagging, we're talking about using technologies like radio frequency energy. I use things like FaceTite, for instance. I love using that along the jawline and the neck, especially when there's some fat deposits in the area. It really helps to tighten up the whole area. And I use that in combination with Morpheus8, which is radio frequency microneedling on the outside. So I like that for sort of early signs. And I've also combined that with other suspension suture techniques like MyEllevate as an arc lift. And that can give you a nice immediate result for the platysma. But again, it's really more for milder cases. After you get to a certain point, you really need that surgical redraping of your soft tissues. I mean, there's nothing yet out there that will do the same, give you the same kind of a result. And so I'll have that conversation. And I would say, I ask them straight out, like, are you ready for surgery? Like, because surgery, if their jaw is really involved here, yes, you can put filler. I've seen plenty of dermatologists, and it looks amazing on Instagram, by the way. People, they'll put a whole bunch of filler along their jawline. But if you see these people in person, they have these super wide jaws. And then for women, I don't think, to each their own, if some people may love the look. Me personally, I don't see that as a feminine looking face to have a very wide jaw. In fact, many people will try to do Botox in their masseter muscles to try and shrink that in because they're looking for more of an oval shape for most people. Now, with guys, still a different story. Guys often want that, strong jawline, which by filling out here, that helps them a lot. But my point is that you have to really understand what it is that people want, what it is that they are willing to go through to achieve that step, and then assess them from a medical standpoint too. Are they healthy enough to go through these types of procedures? Is this someone who just had a stroke a year ago and is on blood thinners? Like maybe it's not time to be doing these types of things, and certainly nothing under general anesthesia, a bigger procedure. And for someone who is looking for a tweak, for instance, I'm like an older gentleman who has a lot of medical issues and has a big turkey neck. I mean, either you can do nothing, or there's even a simple procedure I can do in the office, or you can just do a direct excision of that whole area and remove the skin and the platysmal muscle underneath here and tighten all that stuff up and really make a huge difference. Downsides, of course, there's a downside. It's going to have a scar there. Is it tolerated? Yeah, it's pretty tolerated because it ends up healing pretty well over time. But again, there are pros and cons to all of these different techniques. And I think, as far as the other piece of advice that I would give to people is when you're looking at facial rejuvenation, go to someone who has a big bag of tricks. Don't go somewhere, like, listen, my neck is sagging. What can you do for me? And you're going to like an esthetician or something like that. Like, it's great. Skincare is really important, but they're not going to help fix that. And they may end up pushing you to do certain procedures just because they do it, because they have a hammer and they can use the hammer, but it's not going to be the right procedure to achieve your goals. So you need to go to someone who's going to speak to you honestly about all these different options to help choose the right option for you.
When you see people with that turkey neck that can be so beautifully addressed with the right procedure, and they're hesitant on surgery, what do you see that kind of pushes them over from a non-surgical to surgical to actually address that issue?
Yeah, I mean, if I have to really sit there and hold it up like that, typically it's going to be a surgical fix. If it's something that's significant, yeah. So if they've lost 50 pounds, most likely you're looking at a surgical fix. If they're in their 60s or 70s and they have some significant laxity that I can hold on to, that's not just going to bounce back. You can tell by the skin quality. You pull on the skin and it doesn't move. It's going to be a surgical fix. It's not going to be something that I'm going to even touch with a FaceTite device and say, oh yeah, that's going to just bounce back. Don't worry about it. So it's, but again, you have to understand the pros and cons of all of these different options and have that conversation. And even in that situation, I think it's responsible to discuss with them, what their expectations are. If let's say, okay, well, I still, no matter what, I don't want any surgery. I just want a minimally invasive procedure. Then, tell them honestly, like, well, okay, no problem. I can do this for you. You'll get a little bit of improvement, but it's not going to do this. It's just not. So, and I think only if you understand all the different techniques and technologies out there can you really speak honestly about them.
FaceTite, could you just go into that a little bit more? Go ahead.
Yeah, so it's a radio frequency energy device. It's underneath the skin. It's 1, 2, 3 little incisions. We do it under local anesthesia in the office, so that's kind of cool. People are awake, listen to some music, and we inject something called 2-methylene anesthesia. So you put some fluid underneath the skin, and it numbs the area. It shrinks the blood vessels, so it's totally safe. And then what I do next is I basically lift up the skin with a little probe, a little cannula, and then go in with this device after removing whatever fat I need to remove. And I go in with the device and it heats up the tissues. And the cool thing about it is that I can set it up with safety parameters. So I can tell how high is it getting on the outside of the skin versus the inside of the skin. I can set that up before I start the procedure, and it'll cut off. So I love that about it. It's this bipolar technology. I love how you can have that kind of control and minimize problems. So that's, as far as the contraction process takes time, right? But patients are swollen for about a week or two, and then after that, they're back to themselves. And you can already, especially when you're removing fat from the submental and submandibular areas, you can see that result pretty quickly, which is kind of cool.
Is ARC different? That's your own branded version of this?
So the ARC lift is with the addition of a MyEllevate suture. MyEllevate suture, it's a technology that's been out for a while, a couple of years. And what that is I'll thread a sterile suture in and out of the skin underneath, and it sets up a hammock underneath as well. And what that does is it treats platysmal laxity. So you can actually do something where you cut those bands almost like a little saw, and then you can put that suture in there, and it's a permanent suture. You get a really nice result from it. But again, it's for minimal laxity, and I would say probably not for someone who has really tight bands or anything like that. If it's really tight bands, I really still think that you should be going for surgery, really releasing that muscle and doing things, resetting things and resetting angles properly and things like that. But you can get a nice result from it for sure. I mean, I've seen that personally, but it's about patient selection. It's about finding the right person for the right technology. And that's really for more mild cases. Once you get to more severe sagging, if I can really pull on that skin, we're talking surgery.
Okay. I've had those platysmal bands, which are these bands right here injected with Botox, but the rationale was to fix this kind of area here more down the bottom of my neck, which my neck is taped right now, but just a little looser down here. Can we get down here with that type of procedure or no?
No, so the MyEllevate suture, you can't. No, that it's really just up here. I'm curious, did you, when you got the injections of the Botox, did that help you down here?
I didn't feel like it did.
Yeah, I haven't met a single patient who, and maybe that's because, our practice selects for surgical patients, but I haven't met a single patient who has had Botox in the platysma and been wowed by it. I think, if it's something that is related to, the reason why people have platysma bands is not because they're hanging out like this. That's like a tension thing. And yes, you can relax that. You can relax that a bit, but it's often related to looseness. And so it doesn't really make sense from an aging perspective to me that Botox would fix that. That it needs to be sort of, the whole sheet needs to be ironed out, basically. So Botox is not going to do that. But from an activity phase, just like it does on the face, right? It's going to help to soften the activity of those muscles. So if you see a lot of activity on the neck when you're speaking, and it's something that makes you uncomfortable, then Botox to the platysma band's great. But don't sell me this Nefertiti lift that they were selling on social media for a while. Also, I don't know if it's still popular. Oh, we're going to give you the Botox facelift. What does that mean? What does that mean? It's Botox does not lift. You're doing something. Botox down here is not going to all of a sudden give you this lift along the jawline. I wish it did. Yeah, I was actually thinking about this recently. Where Botox might come in handy in the future, and I wonder, and still like a very small percentage of the population, but people who have large submandibular glands in the area, I do wonder if people are going to do some studies down the line where they're going to start injecting Botox into the submandibular gland to see how much it actually shrinks over time. Because it has been shown that you can inject Botox into the submandibular gland and you'll have some of the gland actually shrink, but it's temporary. And no one, as far as I know, has studied it for repetitive injections over time to see whether or not the actual volume shrinks. So it'll be interesting to see, just throwing it out there down the line. I saw minimally invasive, but the percentage of people anyway for whom the submandibular gland is an isolated problem is pretty small.
Okay, let's keep moving up. Okay, so we talked about that. So as long as we're here, is there anything that you can do to address it, or is it's just too low on the neck? You can't pull back that skin?
Yeah, I mean, you can address it by lifting up skin and muscle and redraping that. If you can do that in this upward vector, you can see that it'll kind of, it'll improve on that. So it depends on how aggressive you are and how low you go on the neck.
Okay.
Can things like, retinols and things like that. I'm curious, what is it? Is it that you see wrinkles, or is that you see activity?
Yeah, it's like just kind of wrinkly, a little more looser skin, like if I were to go like this.
So that may be something that I would address with skincare, truthfully. It's hard for me to see the full definition right now, but even with just including anything that is part of your routine for your face, also address with your neck. Also use your sunscreen on your neck, also use your retinol on your neck. All of those things can also be addressed down here. Chemical peels can also be done on your neck, and they're great. You can even see, I've seen some, we do chemical peels. I typically just do milder peels, but you can do like a croton oil peel on the face, and the results on that are insane. For the neck, you have to be a lot more careful because it's much more sensitive skin.
Okay, I love that. I'm going to explore that more. And the peel that you said got incredible results was?
Yeah, so like things like phenol peels and croton oil peels, those are very specialized peels. You do need to go to a pro or person like that. They actually monitor you under anesthesia for a phenol peel, because you can have things like arrhythmias, changes in your heart rhythm, believe it or not, or something like that. But it is not for the faint of heart. It's not just a regular peel. That's something that someone is going to be super red and swollen for quite some time. But then after they're all kind of crusted up, you see some of these people taking off almost like a mask of their skin and reveal underneath it. That is just insane. Looks incredible. I think it's not necessarily a lost art. It's not something that's performed as frequently nowadays as it used to be, probably. And part of that may be because it's a lost art, or it's just that we have all these other lasers and people don't want to have the same kind of downtime as well. I mean, not everyone wants to can't hide their face for a couple of weeks completely for something like that. If they're going to do it, then they're going to combine that with some surgery and things like that. So yeah, it's pretty cool though, for sure. It is a dramatic change.
Beauty Seekers, we appreciate you. Please subscribe to the channel if you're getting an education and want to continue to learn about aesthetic procedures. Next, we're talking about necks and how those can be addressed